Welcome to Rural Metro's Documenting Ambulance Transport's Field Operations Specific Compliance Training. Additional documentation requirements. By the end of this training, you will be able to correctly document mileage, list which signatures are required for your documentation, document a patient refusal correctly, and list the steps to take to document a patient's death. Correctly documenting a patient encounter is a very important aspect of the patient care process. Knowing how to document can help ensure that your documentation is complete and accurate. Let's take a look at some specific requirements that you will need to know when documenting your patient encounters. One of the key components of your documentation is accurately reporting the mileage driven during a transport. Insurance carriers closely scrutinize mileage reports because some providers have attempted fraud in this area. Therefore, we need to be extremely accurate and consistent when reporting mileage. These are some important guidelines. Report the actual beginning mileage when the patient is loaded on board and ending mileage once at the destination. Use odometer readings and document the total mileage to the tenth of a mile. If there is an unusual situation and you are unable to obtain actual odometer readings, be careful to obtain the mileage from a current and accurate source, such as an online mapping system, for example, MapQuest.com, or your computer-aided dispatch system if appropriate. The use of these aids is an exception and should not be used as a regular practice for documenting mileage. Also, when these tools are used, the route with the least number of miles should be used in the claims filing. The shortest, most efficient route should be utilized when using alternative mileage sources. Care must be taken to document the source of the mileage. Preferably, a copy of the source used shall be scanned as part of the PCR. Signature requirements. Obtaining the correct signatures is vital to a complete patient care report. The Centers for Medicare and Medicaid Services, CMS, has imposed specific regulations regarding signature requirements for all Medicare beneficiary transports. In order for a claim to be filed to the Medicare program, specific signature requirements must be met. Let's take a closer look at these signature requirements. Crew member signatures, beneficiary signatures, authorized representative signatures, receiving facility staff member signatures, crew attestation and hospital staff signature or medical record. Crew member signature. The crew member who provided patient care must sign the PCR. If the crew member's signature is not legible, the crew member's printed name must be provided with the signature. Crew members are prohibited from signing the PCR on behalf of their partner or other caregiver. For the crew member who completes documentation, a signature and title, EMT, paramedic, etc., providing patient care is required on the PCR. The crew member's printed name and certification level should also be on the PCR. Do not forget to include the names and titles of the other crew members. Beneficiary signature. Medicare requires signatures for all transports. If possible, the beneficiary should sign the PCR. If this is done, there is no other patient signature documentation required. However, a crew should never delay treatment in an immediate or emergent situation to obtain a signature. A signature from a patient or his or her representative may confirm ambulance transport services were provided. Authorized consent for treatment, transport, or a release of information for insurance, medical purposes. Acknowledge financial responsibility. Provide an assessment of insurance benefits, and acknowledge receipt of privacy practices. If you are not able to obtain the beneficiary signature, you will need to get the signature of their authorized representative. Authorized representative. When a beneficiary is physically or mentally unable to sign the PCR due to an emergency situation or other physical or mental limitations, his or her authorized representative may sign the PCR on their behalf. The authorized representative must provide his or her name, relationship to the beneficiary, a reason why the beneficiary cannot sign on their own behalf, and their address. This does not place any financial responsibility on the authorized representative unless they are the legal power of attorney or legal guardian of the patient beneficiary. If the authorized representative has signed, there is no other signature documentation required. If the patient is physically or mentally unable to sign the PCR, crew should make a reasonable attempt to obtain the authorized representative's signature at the time of transport, or clearly document if no authorized representative was available. Receiving facility staff member signature. A signature and title of the person assuming responsibility of the patient at the receiving facility is required. Ideally, this is the same person to whom a patient report is given. Crew attestation and hospital staff signature or medical record. When the beneficiary is unable to sign the PCR and there is no authorized representative available, the ambulance crew may provide a contemporaneous statement in the PCR indicating the patient's condition, a valid reason why the beneficiary cannot sign the PCR, and indicate identifying information of the facility destination. In addition, the hospital staff must sign the PCR confirming the beneficiary was received in the facility. This signature does not place financial responsibility on the hospital or its staff. When facility personnel cannot or refuse to sign the PCR, a medical record admission sheet or face sheet that confirms the patient was brought to the facility as a result of an ambulance transport will suffice for the facility signature. When a patient refuses to sign. When a patient is physically and mentally capable of making decisions and they directly refuse to sign the PCR, crew members should document patient refused to sign or choose the refusal option provided in the EPCR. Patients directly refusing to sign the PCR will not have their insurance billed and will be responsible out of pocket for the cost of the transport. However, if a patient is physically and/or mentally incapable of making the decisions to sign the PCR, crew members must document this condition clearly and all signature requirements must be met. Post-transport documentation. When none of these signature options were obtained or cannot be validated, the patient may be contacted in writing after the emergency situation has resolved and be asked to provide a signature confirming the transport, or if the facility is willing to provide medical records confirming the beneficiary was received in the facility as the result of an emergency transport, this would suffice for purposes of filing the claim. Please note that failure to obtain the patient's signature or completion of one of the alternative signature options puts an unnecessary burden on the patient. If the signature requirements are not met at the time of transport, the patient will need to complete the documentation necessary to bill the claim, or they will be held financially responsible for full payment of services rendered. It is also important to understand and properly document the difference between a patient's inability to sign the PCR and the refusal to sign the PCR. If a patient is physically and mentally capable of signing the PCR but refuses to do so, the claim cannot be billed and the patient will be financially responsible for the ambulance transport services. In summary, insurance carriers closely scrutinize mileage reports. Therefore, we need to be extremely accurate and consistent when reporting mileage. Signatures are an integral part of a PCR, and CMS has imposed specific regulations regarding signature requirements. When the beneficiary is unable to sign the PCR, their authorized representative may sign. There are a number of required signatures that are required, for example, crew signatures, patient or authorized representative signature, signature from staff of receiving facility. Patient refusals of care, transport. When a patient refuses care and/or transport, all aspects of dealing with that patient must be documented on the PCR. All documentation requirements for an ambulance transport still apply. Remember to document the refusal so you can completely recreate the situation 2 years later in a courtroom. The mnemonic A3E3P3 may help you to remember the special considerations that help reduce the liability risk when dealing with refusals. A3E3P3. A3 means assess, advise, and avoid. Assess capacity. Does the patient have the legal capacity to consent for or refuse care? Is the patient competent, meaning is he or she A&O times 3? Advise the patient of their condition and appropriate treatments. The patient needs to know what would or may happen if they refuse care. Avoid confusing terminology. Be sure to have the patient read the refusal form or read it slowly to them. E3 means insure, explain, exploit. Ensure that the refusal of the ambulance transport is based on complete information and voluntary. The refusal should not be suggested or encouraged by the crew. Explain that the patient may call back and request the ambulance if symptoms persist or worsen, or the patient may consult his or her personal physician or take him or herself to the hospital. Exploit uncertainty. If the patient is hesitant in his or her refusal, this should be viewed as an implicit invitation to continue to assess the patient and explain the pros and cons of refusing care and transport. P3 means persist, protect, protocols. Persist. The crew should not accept the first no, but rather attempt several times to get the patient to accept care and transport when medically necessary. Protect the crew by full documentation. Besides the physical assessment, completely document the instructions given to the patient. Protocols. Follow the local authorities' clinical protocols and also the operational guidelines for handling refusals. Correcting deficiencies in your documentation. Ambulance personnel who were involved with the ambulance transport may make changes, corrections, and additions to the PCR as long as the late entries or changes are clearly identified and factually accurate. Notes must include the author's initials, the date, and the time the change or addition was made. The key is to make certain that any late entries or changes do not look as though they were done at the same time the document was originally completed. Errors may be corrected by drawing a single line through the incorrect text and then clearly initialing and dating, including the time, the correction, or by completing an addendum form. Do not completely black out an error. Rural Metro employees who were not involved in the patient care during the transport are prohibited from documenting details related to the transport. Supplemental or addendum sheets are also permissible. If several things were omitted on the original PCR, the author can fill out an addendum sheet, clearly noting the date and time it was completed. This addendum sheet is forwarded to the receiving facility and the billing office so it can be attached to the original PCR. Documenting exceptions. Unpredictable events often occur during an ambulance service call. These events may alter standard operating procedures, indicate variance from protocol, or otherwise impact the course of the call. Any unusual occurrences that impact clinical care or operations must be captured in the comments section of the PCR or in an addendum or incident report. Examples of such situations include alteration from standing order or protocols, problems with the patient, family, or bystander that impacted care, medical device problems or failures, documenting a patient's death. It is important to properly document special issues related to persons who are dead or dying. Do not resuscitate DNR orders. Be sure to note on the PCR that you have been presented with a valid DNR that is recognized as legal in your state. Obtain a copy of the DNR if possible. Indicate the date and the authorizing individual's name. Deceased upon ambulance arrival. If the patient is deceased upon your arrival, completely indicate the obvious signs of death. Run an ECG strip if available in 3 leads and attach a tracing to the PCR. Be sure to note the time you affirmed the death for the death certificate. Termination of resuscitation. If permitted in your system, termination of resuscitation must be thoroughly documented. Besides the patient assessment and interventions, documentation must include the precise point in the treatment plan that the decision to terminate was made and how this decision was authorized through medical control. Again, it is important to document the time the code was terminated for the death certificate. In summary, we need to be extremely accurate and consistent when reporting mileage using actual beginning and ending odometer readings to the 10th of a mile whenever possible. CMS has very specific regulations regarding the signature requirements for all Medicare beneficiary transports. A claim cannot be billed to Medicare without the beneficiary signature requirements being met. When a patient refuses care and/or transport, documentation must include all aspects of dealing with the patient, and all requirements for a transport still apply. Use A3, E3, P3 to remember special considerations. Changes, corrections, and additions to a PCR, including supplemental sheets, are allowed as long as they are factually accurate and clearly identified with the author's initials, the date, and the time the change or addition was made. Errors should be struck with a single line through the incorrect text. Any unusual occurrences that impact clinical care or operations must be recorded in the comments section of the PCR or in an addendum or incident report. It is important to properly document issues related to persons who are dead or dying, including DNR orders, deceased upon ambulance arrival, and termination of resuscitation. Congratulations! You have completed specific compliance training. Additional documentation requirements.